Countries should be looking more at domestic resource mobilization, what they themselves can do to make their health systems self-generating and self-sustaining. I wonder if you would address that.
Yes, thank you. Maybe just to comment on swapping being a physician to being a politician. I don't see myself as a politician. I entered politics because I lived in an apartheid country and I wanted to change it. And that's how I came to be. So just to put that in perspective, I just want to maybe start somewhere else. In Africa, when we look at health, I think it's still very important for us to look at other health determinants. Because you can have as much money for doctors and nurses, but if people are drinking dirty water and children are still drinking water that gives them diarrheal diseases, they will still die. So I think in developed countries that is taken for granted, but in our part of the world, clean water is part of health, nutrition is part of health, and so the investment has to be done not only in the health system, but in making sure that children can have clean water, they can have food, nutrition, but also energy, clean energy. Having said that, yes, it is something that we have recognized as Africa, that clearly our development needs resources, but the mainstay of our development cannot be donor funded. We need to mobilize our domestic resources and even look at alternate sources of funding other than the fiscus in order to be able to fund. And of course, accept graciously the donations, but also make sure we do. And I think it's possible to do that. It's not all countries in Africa that are funded only through donors. There are quite a number of countries who are funding their health system, but also a lot of countries are increasingly increasing the domestic component. So that, and I think also during the Ebola, we saw how African countries rose and were able to send more than 800 health workers to those 3 countries, paying for them in their own countries as health workers, but also we mobilize also domestic resources from our business and so on to fund that. And I think we need to continue and not just stop because Ebola is over. We need to continue mobilizing the resources, both domestically and internationally.
And you highlight a very important factor, which is that South-South collaboration and cooperation, as well as you said, between African countries and those in the West. But in terms of implementing these recommendations at regional level, is it something that the African Union is going to try to bring to its discussions when you discuss the health sector? It is.
Yes, in fact, if you look at our own Agenda 2063, which is an Africa-specific development plan, we talk about skills revolution, and amongst those skills, obviously, are health-related skills, because we have recognized that we have a big shortage of skills, and more so in the STEM areas. And so it's something that we are already mobilizing. For instance, yesterday I attended a meeting looking at mobilizing resources led by business people, and first ladies and organizations like the AU to mobilize for STEM, which is science, technology, engineering, and maths, because we recognize that going forward, we're going to need we need those resources today and tomorrow. So we are going to implement, not only because the report says so, because we think it's right and for our needs in Africa.
Thank you very much indeed.